Hi, my name is Nina Means, and I'm the director for the Austin Community College Fashion Incubator. And we are really excited to bring to you today ACCFI Presents. Thank you so much just for a couple of minutes of us getting situated and getting up for this 10 o'clock session. We are starting a couple minutes behind, so we'll run over just a little bit just to deliver you the content that we promised. I wanted to take a minute. Today what we're talking about is how to design with the end user in mind. And with everything that's going on with personal protective equipment in the current climate, what we wanted to do is to take a minute to talk with a medical professional who also happens to be my sister. Her name is Lea Porche. She is a OBGYN, MFM. I can't say there are more letters in her credentials than there are in her name. However, she is working in a variety of settings, clinic and in the hospital, and so she'll give us a good idea of what it means to what does the PPE need on the end user, the healthcare worker, and what are the design things that people who are helping to create these products really need to kind of keep in mind. So we'll get an idea about how the pandemic's going on out where she is, as well as getting a chance to talk a little bit more about the design of the product for the user, as well as the design of the product to flatten the curve for COVID-19. So without any further ado, I'd love to introduce you to Lea Porche of Eastern Virginia Medical Center. Thanks for joining us.
Hey, thanks for having me.
So I wanted to find out from you, Lea, Dr. Porche, how are things where you are during the pandemic?
So, in my area, I'm in Norfolk, Virginia. That's in the eastern coastal part of Virginia. And we have been doing, I think, a lot better than a lot of other places. Definitely not at the level that New York has been hit. We have definitely seen cases. We've had some ICU admissions and some fatalities from COVID-19. In my field, we do obstetrics. I'm an obstetrician, so I do pregnancy-related care. We have had some pregnant patients that have been positive COVID-19 as well. To date, we have not had any COVID fatalities in our center, which we're grateful for.
Wow. So tell me a little bit about what it's like treating patients with COVID-19 who are also, carrying a child. So, is there, a shortage of PPE to be able to see these patients? Or are you guys having to find ways to mitigate that issue?
Yeah, so with the national shortage of PPE, we've needed to get creative and the safest way to reuse the personal equipment that we have. So a couple of the ways that the hospital and the clinic have been doing this is they basically ration our PPE. So especially, we have different kinds of masks that we use. There's a normal surgical mask, and then there's the fitted N95 mask that have a higher filter and is more protective against airborne diseases. So as you can see on my desk here, we've got 5 bags. Each bag I have
Okay.
So I have one for each day of the week for use in clinic. And I place it back in the bag, so it's aerated. But if there's any contamination on the surface, then any live virus should not persist for a week on an inanimate surface. So that's how we're reusing. Every Monday I use my Monday mask, and every Tuesday I use my Tuesday mask, and that's how we're reusing in the clinic. In the hospital, they have created a system to clean or sterilize the mask. So once you're done with the mask, if it has not been overtly soiled, then you return it, they clean it, and then they reissue it to another provider at another date. So it's not ideal, but it is a way to extend the life of the protective equipment that we have.
That is so interesting. Now, I didn't even think about the life of the virus on the surface of the mask itself. I know people have either been talking about whether you throw the mask away after each use or whether you sterilize it the way that the hospital is saying. But this is the first time I'm hearing the Monday mask for Monday, Tuesday mask for Tuesday, and then the understanding of how long the virus lives on a surface. So how many days did you say the virus lives on the surface of a piece of a mask or equipment?
So my understanding, and please forgive me if I have it slightly incorrect, is on different surfaces, it can live for different amount of time. So on card versus metal versus plastic, the longest that I have heard is 72 hours.
6 hours?
72 hours.
72 hours. Thank you.
And so the idea is that if we're not reusing a mask within a week's time frame, then that should be more than enough time for that to be kind of eradicated by natural causes. Yes.
I see. That makes so much sense. So all of those are N95 masks in your bags?
Correct. We are our department is very proactive, and I feel we are very privileged that we have the number per provider that we have, because this is not the case in the entire country. So I'm very, very grateful for how our department's been proactive and with members.
That's excellent. So in the case of, because I think that was getting my next question was about how the hospital was different from the clinic. So, do you feel like the hospital has what they need currently to be able to meet the demand of how frequently they're seeing patients as opposed to what happens in the clinic? Or are there other things that they're doing to kind of help meet that demand? I think we had talked a little bit about some different creative solutions about creating more equipment.
So it is a very different environment between the clinic and the hospital. The difficulty with this virus, though, is that it is spread primarily before patients are symptomatic. So you can't just use PPE with symptomatic patients and expect to be completely protected.
Understood.
So that's why we're putting protocols in place for basically universal, kind of assume the person is infected and you'll be better protected against getting the virus from an ACC. So in the hospital, with every patient encounter, you are to wear an N95 mask, you are to wear a surgical mask on top of the N95 mask to keep it partly soiled. So of course I'm in obstetrics, so you don't want to get splashed with fluid or with blood, and then that mask is no longer usable. So for the N95 plus another mask, plus eye protection. Glasses are not sufficient. They have to be eye protection that wraps around. This is a face shield that was created by some of the medical students, and we can go back to a little bit.
Right.
But have to have face protection as well. So each patient, if you were to have a positive patient that someone later is now proven positive, if you did not have all of that equipment in place, you would have to go on a 14-day quarantine to determine if you were then infected. So if you were not wearing N95 or you were not wearing a face shield, now you're out of commission for 14 days because you were not adequately.
That's incredible that you guys are that you're doing those measures, because I feel like there's been, depending on the level of, volume of patients or, maybe I'm not exactly sure where the decision points are for hospitals, but the fact that you guys would then remove your staff out of commission to make sure that you have a healthy workforce is an incredible, I'm happy to hear that that's what they're doing in your case. Because I don't feel like that's been happening across the country. I think that sounds like a unique experience because people have to keep showing up and keep being at work. I don't know if you've heard of, others in your network having similar experiences or if this is a unique one.
So I think, the way that our hospital system works, we try to make rules that are kind of across the board. We have the medical school and we also have the hospital system. And so our hospital system is a lot of local hospitals in the area. So they try to make protocols that are across the board. the 2 weeks of quarantine, I believe, is part of our medical school protocol, and that really is to keep someone who may have been exposed from then being a vector for exposing other people.
Wow.
For themselves to be safe, but also that they're not spreading the virus without knowing it themselves.
Wow. Okay, so I think for our design community and industry community who are listening in on this conversation, and maybe you just joined in, you may be wondering, why are we talking so much about what the healthcare experience is? And what we want to talk about is really how are we designing a product that's appropriate for what's happening at the end user space. And so one of the things that we've learned is that having the virus can actually die kind of on an inanimate surface, meaning as long as it's not a living, breathing surface, it could be, a tabletop or, anything that's hard. Is that, how would you describe inanimate just for our lay, community? I
think that you described it well. Nothing, it would die faster on something that's not porous.
Okay.
But also if there's no life energy, there's no metabolism going on, nothing for them to infect, because a virus has to have cells to infect to then continue to live. So nothing that live cells to infect, it would not be able to persist indefinitely.
I see. Got it. Thank you. That makes so much sense. So really, you're looking at 72 hours of life of the virus on something that's not living, something that cannot be infected by the virus. And so for that period of time, for that 72 hours, you guys are actually cycling through 5 masks a week, for your timeline. So you're not changing it in between patients, but you are changing it day to day. That's how we're understanding it. But on top of that, you're actually combining the use of the N95 mask with a surgical mask, or a mask cover. I've been seeing a lot of these mask covers to prevent soiling of the N95 mask. It sounds like it's effective from your standpoint. And then coupling it with a shield where eyeglasses are not sufficient. You actually need something that's going to cover the sides of your face as well. It's not going to be enough just to have the eyeglasses.
And there are some goggles that are made that wrap around.
Okay.
That are sufficient. But if you do have goggles that wrap all the way around, and especially if you're dealing with a patient that is a person under investigation or positive, then you really need to have that face protection.
Got it. So the face shield. So if a doctor or a provider is not wearing all of those things, and you find out that a patient that was probably pre-symptomatic or asymptomatic, is now actually positive for the virus. Now what we do is we're saying, hey, you know what, doctor, you need to be quarantined, or nurse, you need to be quarantined for 14 days to make sure that you don't continue to spread it. So all of those pieces are now really crucial. So, for designers, this is really where the opportunity comes in. We talk to industrial designers quite a lot. We talk to people who use the 3D printing systems a lot. We actually just cut some of our first face shields yesterday at the Fashion Incubator, with our production coordinator, Michelle French. And so we are looking to cut more of those in the future. We also cut some surgical caps yesterday, about 200 of those. And so there's a lot of exciting projects that we have on tap with barrier fabrics that are helping. Surgical gowns are now being requested. But what we're trying to do is to understand, how does the healthcare worker actually use it? How frequent are they using it? When is the discard opportunity? Because now that tells us a lot about the material that needs to be used, how it needs to be designed, if the face cover is effective or not over the N95. And I'm hearing that, yes, it is. To prevent soiling, it's easier to reuse it over time. And so these are all things that we want to consider when, there's a lot of amazing, good-hearted people out there who want to help and want to stitch and, help create garments, but they need to be able to be sterilized. And, reusable is preferred, I would imagine. But I think that there's a bit more to learn on that. Could you kind of speak more about, there's good people who want to do something. What's the best thing to help you,
Right. So I think one of the things that is probably the most helpful is, and let me put this somewhere or it's not going to be so shaky. I apologize.
No worries. Time out of your schedule. I know you've been seeing patients. You are really in clinic today, so I appreciate your team member covering for you to be able to join us on this call.
So there's a couple of different things that I feel like I've seen people in our community do to be helpful, and that continues to be a really great use of resources. Like you said, having a mask that covers the N95 to help keep it clean. We have had some people donate cloth masks to the hospital, and providers are able to wear those themselves over. If they have not been soiled, then they usually will take them home and wash them themselves. If there are kind of inexpensive and disposable versions of that, that is the most ideal. Most of this PPE was really truly designed to be a one-time use. And we have been extending its use and being creative with its longevity because we have needed to do that. So if there are that are inexpensive but durable enough that they can be disposable, that would be fantastic. If they are not, then if they are strong enough and sturdy enough to be sterilized, that would also be wonderful. One of the things that people have also been talking about are scrub caps or bouffant caps to cover your in the hospital, in the surgical suite, we are still required, even if you have a cloth, either homemade or professionally made cloth hair covering, you're still required to cover it with a disposable bouffant cap in a surgical setting. Now,
I got your picture that you sent to me. Do you want me to share the picture of the bouffant cap?
Yeah, so if you can share the blue one, the blue picture.
Okay.
So that cap is a disposable, one-time use bouffant cap that is used not only to protect the provider's hair, but keep hair from falling into the surgical field. The idea is that that's, again, like I said, one-time use. It's not to be kind of taken in and out of the operating room. And so those are still required if you're doing surgery, opening someone up. Now, there's the other picture of the surgical caps.
Let me see if I can pull that up. Let me turn off my sharing. Oops. I muted myself for a second. Let me see if I can pull up the other one you sent to me.
Sure.
I see this. Yes, I'm ready to share it now. Let's see.
There are multiple designs of surgical caps that are reusable. They're customizable. People like them because they can express their own personality. But they are, the utility in them is, one, again, to keep hair from falling onto a patient or onto a surgical field. But two, to protect the provider from having drops that are kind of contaminating their own hair. So these are very useful and very helpful. If there's someone who works in a surgical suite, then they would still require a second disposable scrub cap to be placed over it. And again, there's a lot of different styles. The style is really just a personal preference. It doesn't change the way the cap works. But that's another thing that people have been doing and donating. It is helpful as far as the provider as well.
Okay. Well, that's good. That's really helpful to know because I think that we've been seeing requests go out. And so, just anecdotally, I remember I heard about a nurse recently requesting a specific kind of surgical cap, and they already had the bouffants in stock at the hospital. And so they're like, so can you use the bouffant, or do you, and it sounded like, do sometimes it feel like a style decision specifically at times, or is there, Sorry, I've got an eye out on the little one. That's why my eyes are shifting. I was like, what are you doing over there? So no, he's within arm's reach. So at any rate, I wanted to just find out, like, so what it sounded like from what you described was that really all of these are helpful and they can work for what they're designed to be used for, whether they're made at home or if they're the bouffant cap.
Correct. Yeah.
Okay.
So there's multiple different styles of caps, multiple different styles of masks. I'm sure that you've seen there's multiple styles. There's a pleated mask. There's the mask that's kind of more up around the nose. Some people put plastic on the ears. Some people put ties instead.
Yes.
People have made headbands with buttons so that the elastic doesn't bother the back of the provider's ears. So there's a lot of different ways that people are customizing it.
Right.
Wearing this equipment for their entire shift. And so they're trying to make it also ergonomic and comfortable. So the main thing is that it covers. That is the main the efficacy of it, is that whether it's your hair or whether it's a mask, whether it's a gown, is that it covers, that protects the person wearing it and also protects the equipment that we're having for long term.
Right. So you sent me this image of what makes the mask effective in terms of protecting yourself and protecting others. I'm going to see if I can actually enlarge this image just a little bit so that it's a little bit easier to see when I share it. But I wanted to bring out something really important that you just shared, though. You said, in terms of the comfort level, that's something that I know that we really want to focus on coverage because we just want to make sure people don't get sick. But if the garment doesn't allow you to wear for 12 hours straight or 24 hours straight, your likelihood of wearing it correctly has gone down. Absolutely. And so in terms of a designer, designers, whenever we're creating these things, that we need to think about comfort as well. And so if they're behind the ears, we need to see if the elastic can be positioned so that it doesn't cause rubbing here, over hours and hours of wear. These are really important details to consider. So thank you for bringing that out because, that's another end user experience that as a designer or a home stitcher, you may not think about because you're not wearing it that way. You may be just running to the grocery store for an hour, or you may be, making a quick, walk around the block and you decided that you did want to cover up while you walked around your neighborhood, which is not that's really what they're recommending. So, in terms of, what you guys need, healthcare providers on a variety of parts of the spectrum is, something that allows you to wear it the entire shift. We didn't think about that. So thank you for bringing that out. I want to share this one last image. We've got a couple of minutes here. So if you start a little late, I'm going to give us a couple extra minutes, but not too much because I know you've got more patience to see. So I'm going to share this one last image here. Let's see. This is the one that you shared with me that's about protecting yourself as well as protecting others. Correct. So can you tell me a little bit about why we're looking at this particular image?
Yeah, so it's a way to kind of visualize what does the mask do for you versus other people. So if you look at the image on the left, you say there's a healthy person wearing a mask, and say there's a person who's infected that is within 6 feet and they cough or they sneeze their face. So that would be fortunate, but say that happens. So if you look at the red particles outside the mask versus the red particles inside of the mask, and then they give you numbers down in this chart. So say a homemade mask, you would have, with a homemade mask, you may get 33 particles that get through that mask. With a mask that's made for surgical purposes, then you may have somewhat less, 25 particles that get through out of 100 that get through that mask. Now with the N95, and this is when we have to go to employee health, we have to get fitted. There's a whole process to be tested if you have the right size. You get one particle with the N95. Wow. That's why these are so important as far as protective equipment for healthcare workers.
I see.
Now we're talking about looking at the picture on the right. So let's say there's a person who's infected, but more importantly, let's say there's a person who doesn't know they are infected. They have had no symptoms, issues, but they are still able to spread the virus. And this is one of the reasons why this virus has been so incredibly virulent and excuse me, I'm sorry. That's why this virus has been so virulent and easy to spread, is because
we have a little bit of a breakdown. I know it's like right at the cusp of like, it's so important to know this one thing, and then it's like cut.
So the reason why this virus has been so easy to spread is that people can spread it before they even know they have it. So before you even know to be on, or before you know to stay at home, before you have any symptoms at all, you can be spreading it for 10 to 14 days. So say you have a person that's positive, or they don't know that they're COVID, and they wear a mask outside, they're going to be even more protected around them than if those people were wearing a mask. Okay? And so that's why it's just so important that we take these social distancing measures to heart, that we go with the CDC's recommendation that when you go to the grocery store, you go to Target, anywhere that you really have to go, that you put this mask on, because not only are you protecting yourself, as you can see in the first picture, but you can really help to protect other people who could be vulnerable population before you even know that you're still.
Wow. Lea, thank you so much. I'm going to stop sharing this here. Thank you for breaking that down. I think that really helps to clear up how these things are working in the community. And I think that, we hear about it on the news, we get the recommendation and the guidelines. We see, maybe our city officials get on air and talk about what they want us to do or what they prefer for us to do. We hear about states reopening before curves have flattened. And, there's a lot of concern that we're all having about that and what that's going to mean for the spread of the pandemic. But what I wanted us to get out of this more than anything is that, we have an opportunity as a design community to consider all of those outputs in terms of why these particular garments are needed and how they're being utilized and where the opportunities are to prevent the spread. So that we design into that need effectively. So we're really excited that we got a chance to talk with you as an expert working in the clinical setting as well as in the hospital, and to be able to understand a bit more about how those things are being used, even though, even in that 5-day system, which is incredible to me. I didn't even know you were doing that, that it's still not as designed. Those are still supposed to be a one-time use mask that you are kind of sterilizing by time. And hoping that, everything's okay. So please stay safe. We're definitely, and I'm glad that they're taking additional measures to make sure that you guys are safe. But the face shields are definitely still needed. And so we'll be cutting more face shields at the ACC Fashion Incubator. There are other communities that are cutting face shields, homes, people who are using their 3D printers to do the visor system to get ready for that. So that's really exciting work and absolutely needed. The face coverings over the N95 mask sounds like it's creating some help, in the context that you shared. So that's good to hear from a medical professional. I think there's been a bit of a debate about that, but I think that if it's coupled with the face shield, it sounds like it's, less likely you created multiple barriers before getting to your face. So that's a great way for us to keep our front line safe. So, guys, I wanted to just say thank you again to Dr. Lea Porche of Eastern Virginia Medical Center. She's been an incredible, advocate for maternal health, specifically in the African American community. She's done quite a lot of talks on that. She's also, been doing incredible work just in research, in this space, but helping us to understand how personal protective equipment, PPE, is being used currently in the clinical setting as well as in the hospital things. So, Dr. Porche, thank you so much for your time.
Thank you so much for me, and thank you for doing this. This is really for people that have good info on, and I'm really glad that you have committed to not only making it but that's actually going to be useful. So thank you so much for spreading this information.
Thank you. Thank you. So we're really happy to have you. Every week we're back here at ACCFI Presents, and we are doing, we'll be speaking with different people in the community, as well as the country at large, just sharing about different parts of what's happening across the country in terms of the pandemic, but also how it relates back to the design community. So feel free to reach us back here at 10 a.m. on Friday next week for ACCFI Presents.
I'm getting hammer called. I have to get hammer called.
Oh, yes. You have a clinical. I apologize.
Thanks. Have a great day. Thank you so much.
Go back to work. All right, thank you so much, Dr. Porche. Thank you for joining us. We'll let you get back to work. I'll do the close. Thanks so much for joining us for ACCFI Presents. Again, my name is Nina Means. I'm the director here at the ACC Fashion Incubator. And we were joined today with Dr. Lea Porche, who's over at Eastern Virginia Medical Center, giving us a glimpse into the life of what it's like to be a healthcare provider in the clinic as well as in the hospital. So what we'd love for you to do is to follow us on all of our social handles at ACC Fashion Incubator. You can find us on Instagram, LinkedIn, Facebook, and Twitter. Now we have our own YouTube live channel, so you can hit that subscribe button and keep up with all of our great content that's coming up, here in the coming weeks. On Mondays, you can catch us for Coffee Talk, which is a great time if you RSVP to send me a few questions that you want me to answer live. We also have a really great chat that's available during that time. So if there are questions that come up from the things that we're talking about, it's an opportunity for you to kind of drop us a quick note, and we're happy to answer that while we're on the air. On Wednesdays, we have Workshop Wednesdays, which is a great opportunity for us to go over content that's specific to helping you get to the next level. So we're kind of giving you a glimpse into some of the really great information that you would need to think about how would you work virtually in this time, and really introducing some ideas around the tech pack, which is really kind of the bread and butter of our industry. And then on Fridays, you can join us back at ACCFI Presents. This is when we're going to be interviewing people across our industry and being able to share about different parts of how is the pandemic affecting them, what are they doing to move forward, and how can we help, as a community really hold each other up during this time. So watch your email. You will be posting when those things are happening, and this will be a really great opportunity for us to hear from you as well about the things that you need from us. Again, we're the ACC Fashion Incubator. We're really excited to be a part of this community. We would love for you to join our community and register for our email list at fashion.incubator@austincc.edu, and check us out on our social handles at ACC Fashion Incubator. Thanks so much for joining us for ACCFI Presents. We'll see you soon.